Well, I've been a nurse for 26 years. I started in a critical care setting right out of college in a coronary care unit, and then I worked in different critical care settings, coronary care, intensive care. I worked in a pediatric ICU for a while, in ER for a while. My love has always been EMS and ambulance kind of things. As a kid, I watched those kind of shows on TV. I really just enjoyed that, and so when the opportunity came, when I moved to Nebraska to work for a helicopter service, I just jumped at the chance, and this is by far the best job that I've ever had. It's the one that I enjoy the best out of all the different kinds that I've done. So the staff that works on a air medical helicopter there's basically three people. The pilot, and we run with a paramedic and with a nurse. There are some programs that run with two nurses. There are some programs that run with a nurse and a respiratory therapist. The advantage that I feel we have running nurse and paramedic is you're bringing a person, the nurse, from the hospital side of things and the experiences and the knowledge of medications and stuff from the hospital aspect, and then you've got a paramedic who's used to doing scene work with automobile crashes and taking and putting people together to get them to a trauma center. So I think you have the benefit with having one from each area, bringing their expertise. When we work together in the aircraft, you can't tell who's a nurse and who's a paramedic. We do the same things. We both do the documentation. We both give drugs. We both manage patients' airways. So you really can't tell the difference between the two of us. And then actually the fourth person that's not on the crew but is definitely a vital part of our program is our mechanic, because they have to have us set to go all the time. In order to do the nursing job that's required in an air ambulance, you really need to have a lot of variety as far as experience go, pediatrics, adults. The critical care settings are really important, either ICU, ER, both are even better. When they look at hiring nurses for a program like this, they look at how much experience you've had and what type it is. You have to have a minimum of 3 years of nursing experience, but then it's the kinds of experiences that you've had. And whether you've done kids and adults, and because we take care of a lot of different types of patients on the helicopter. We can take a 2-year-old and we can take an 80-year-old with all different kinds of problems, and you need to be able to work with any kind of situation, any kind of patient. To be a flight nurse, you obviously need to be a nurse first, and so science and math are probably the things that you need to pay closer attention to, but you also need to be somebody that has a lot of compassion, because that's just part of nursing, is caring about people and how they feel and how they're doing and that kind of thing. So science and math, and then your ability to really be concerned about other people. Once you get through your nursing program, and I really don't think it matters whether you have a 3-year degree program or you have a bachelor's program. That's not going to make the difference on whether you get hired or not. What's going to make the difference is the experiences that you have. So once you get out of nursing, typically it was unusual for me to get into a critical care setting right out of nursing school. That's not typical, but they need to get into a hospital facility and then start making moves towards getting into a critical care setting, either an ER or an ICU, and then continuing with that and maybe moving around a little bit and getting some different experience before they think about applying for a flight nurse position. As far as what we need to know when you get hired here, there's several different certifications that you have to have, and some of those are the same that you would have to have as if you worked in an ICU someplace. You have to obviously be certified in CPR. You have to be certified in adult advanced life support. You have to be certified in pediatric advanced life support and in neonatal advanced life support. In addition to that, every nurse has some type of trauma certification, and then some type of specialty certification, either a national test where you become a certified flight nurse, a national test where you become a certified critical care nurse, or a certified emergency room nurse. One of those 3 certifications you have to have in order to work on the helicopter. As far as flying, we have we can get a call and not be even back from the first call and take a second flight, you know, providing we have enough supplies and stuff to do that. And that happens. This program averages about 30 calls a month, which is a flight a day, but there are days when you can't fly because of the weather. So that means there's other days where you might get 2 or 3 flights. And from here, because we're in a little bit more rural setting, our flights are longer. So start to finish, we average about 3 hours to go get a patient, take them to the hospital where they need to go, and then get back home. The types of flights that we do are actually twofold. We go to a scene, and that scene could be for some type of trauma. So it could be for a car accident or a farm accident or something like that. Or it could be in a rural setting where we might go to a scene where somebody's having a heart attack. So we get some medical patients from a scene as well. And then from a hospital, we'll get anything. We could get a patient that was in a motor vehicle accident that was brought into the smaller town hospital and now needs to go to a trauma center, or we may get somebody that's got a medical problem, whether it's a stroke, a heart attack, some massive infection, maybe they're got pneumonia, need to be on a ventilator, something like that. So it really varies. And age-wise, by policy, we take infants. We can't take newborns, but we take infants after they're 2 months old. We can fly them, and then anywhere up from there, up to as old as you get. So I would say in terms of the flight volume that we do more hospital-to-hospital flights than we do scene flights. And then in terms of types of patients, I don't have specific numbers, but I would say, if you just kind of by feel, that we probably do more heart attacks and cardiac patients and stroke patients. Those are probably, from the hospital situation, those are the larger numbers that we do. In the winter months, when there's a lot of respiratory stuff going around, that's typically when we do more pediatric patients. Today, when we came into work, our shift starts at 8 o'clock in the morning. We do a 24-hour shift. And we usually try to get here a few minutes early, and at 10 minutes to 8 we had a flight request and to a smaller town south and west of here, for a farm accident where the person had an injury with their tractor. And that person was not critically injured, but certainly needed immediate help so that he wouldn't lose one of the limbs that he had injured in that accident. So we went and picked him up, and then we took him down to Omaha to one of the trauma centers, where then they can take care of his injury and hopefully save that limb. The pay for a flight nurse is going to, first of all, vary depending on what part of the country you work in. Typically here, if you the flight nurses here in Norfolk do not make as much money as the nurses in the hospital. But the reason for that is because of the types of hours. We don't get all the shift differentials and those kind of things. But our schedule is something that, is a really good trade-off. I work a 24-hour shift once every 4 days, and the rest of the days are, I'm free. And one of the things for me and my family was, when I was working 12-hour shifts at the hospital, I got up before the kids were up in the morning, and I got home after they were in bed, so I never got to see them anyway. So this way I'm gone for 24 hours, but I get actually more time with my family than I do if I were working in the hospital. This is a small group of people that we work with. There's 4 nurses and 4 paramedics and 4 pilots. And then we have a couple of other ones that fill in on occasion, but we're pretty close-knit. So we know when each other's kids are having birthdays and when they're graduating and all those kind of things. And I think that the people here are genuinely really concerned about each other. And yeah, we're real close. I mean, when you live with somebody for 24 hours, you gotta like how they keep house, you gotta like how they cook or what they want to eat. It's just like family, really, being here. And we're pretty open to, if somebody's husband or wife stops by, welcoming them in and, making them feel real comfortable here at the office, if they stop in for a visit or something like that. So, yeah. The kind of qualities that a flight nurse or a flight paramedic, and I would say a pilot too, what they need to have is they need to be willing to work with the team. They need to be very flexible, because nothing out there is textbook. Every time we go, it's a little different. Just when you think that, well, all overdose cases are like that, then there's one that's not. So you need to be able to adjust to whatever the environment or the situation presents to you. So those would be two of the big ones. The other one and part of why I really like this job is the autonomy that you have. We don't typically call a physician every time we want to give a medication, or if we think we need to make some change in how the patient's being cared for. We're just able to do that. But you have to be assertive and autonomous enough to be willing to do that. And there are a lot of nurses in the hospital that certainly could do that, but the routine is, well, we'll call and get an order from the doctor. And we don't typically do that. We have protocols that we follow. If you need to vary from those protocols at all, you need to make sure that you're quite able to justify why you did that, because it will be questioned. But you have to be willing to flex with the system and know what to do if something doesn't go quite the way it's supposed to go according to the protocols. And that's why our experience is so important, because if you've never taken care of a child before, and now you've got a child that you're caring for, and all of a sudden he doesn't fit your little textbook protocols, then what are you going to do? You have to be able to think outside the box, I guess is the term that we usually use. One of the things, I guess, that has become my soapbox since being a flight nurse is the number of kids, the large number of kids that we have to fly because they're drinking, driving, and no seatbelt. And truly, those are just critical mistakes that kids make. And I know everybody thinks that, well, it's not going to happen to me, it's not going to happen to me. And I'm a very good driver, but you know what? It's the other driver out there on the road that may hit them. And just the fact that seatbelts, you may get hurt if you're in a car accident and you're wearing your seatbelt, but you will be hurt much worse and more likely not survive your injuries if you're thrown from that vehicle. And the only way to keep you in that vehicle is to wear a seatbelt. My favorite thing about this job is it's never the same 2 days in a row. So there's a lot of variety. I don't like routine. I like to have things change all the time. So that happens. The other thing is the fact that whatever I do, I see pretty quickly results from that. So if we're taking care of a patient and I give him pain medication, I can see that the pain goes away. If he's bleeding and we do something to stop that bleeding, you can see him improve. I like that part of it. But I think the biggest part is it's very rewarding. It's very rewarding to take somebody when this is their absolute worst day because they just were thrown out of a vehicle or something, and for you to go in there and be the best thing in their worst day and being able to maybe turn their life around because you were there to help. So I think that's probably the biggest part, is just how rewarding this career has been.